To expand on some of the numbers we're seeing, as the Minister said, we've had 87 new cases reported up until last night, which, although it's early days, seems to look at a stabilisation of some of our numbers in the last few days. Numbers of new cases, of course, fluctuate from day to day, and we are very keen that testing continue for those areas that we've previously explained, particularly in areas where there may be community transmission, such as the Bondi area. Of the total number of cases confirmed, of the 2,580, the majority still are acquired overseas, 1,566, with 578 acquired locally from a known confirmed case or cluster, and 380 locally acquired but without a direct contact with a known case or cluster, and 56 remain under investigation. As the Minister said, we are seeing all age groups affected. The older people and people with underlying health problems, cardiac or chest or immune problems, are most prone to getting severe disease and requiring intensive care and ventilation. But younger people are getting infected as well. And the biggest single age group is the people in their 20s. We're seeing the largest numbers. And in fact, we've seen also 3 people who have ventilated intensive care in their 30s. So it's a really important message is that younger people need to be aware that they're not immune from getting severe disease, and they have an important role to play in preventing transfer of the infection to their loved ones, to their friends, to others, and to healthcare workers. So it's really important that we all take the messages about social distancing, about staying at home except for those essential reasons, very seriously. None of us are invulnerable to this disease, and it can have very nasty outcomes indeed. But it is pleasing to see early signs of stabilisation, which is down to a number of important facts. One is the early detection of cases, so people coming forward and getting tested if they have the symptoms and the risks, that they come forward for testing so we can identify them and care for them and make sure that their contacts are identified so that they won't on-spread it to other people. So it's case finding and contact tracing is a really important part of what we're doing around the clock. But those other messages for the more general community about social distancing, not gathering together in groups of more than 2, is really important for the more broad community to make sure that we're all doing our bit to prevent transmission. And it's really pleasing to see that that seems to be paying off in the figures we're seeing. Thank you.
There have been 4 extra deaths confirmed today. Do we have any more details about those people that have died?
Yeah, so the 4 deaths, very sadly, a 91-year-old, 80-year-old male, both males, a 76-year-old male and a 61-year-old male. And our condolences go to the family. That brings a total of 16 deaths in New South Wales. And it just it reinforces that message that the elderly and people with underlying diseases are most prone to severe complications, intensive care and death. But most people don't get severe disease. 80%, we believe, have mild disease or moderate disease, and most of those people can be cared for at home. And a minority, a smaller proportion, require hospitalisation and sometimes intensive care. But those ages, people of younger age people can also require intensive care and hospitalisation.
Are we starting to flatten the curve?
Look, it's early times and we don't want to be too... we want to be hopeful but not overread the figures. So for the last few days we've seen numbers bounce around without escalating at the same levels we've seen before. So we're hopeful that we are starting to flatten the curve, but there's more work to be done, and it's important that we all heed those messages.
What will you need to see to know that, sir?
we need a longer term trend, and we'd like to see, as these measures continue, numbers flattening and even declining, and then we'll need to make sure that we're not having complacency in the community, because we've seen internationally where we think there's good news, people kind of relax the measures, and then that leads to an upswing in cases. So we need not to overread the figures. We need to realise that it's down to all of us to make sure that we're maintaining that good social distancing, that staying at home if you're in isolation, and getting tested if you have the symptoms.
4 people that died overnight. Sorry, 4 people that you've announced have died. Where did they contract the disease? Were they overseas or very local?
So I don't have all that information, but 3 were acquired outside New South Wales.
What areas of New South Wales?
So, one on the north coast, 2 at Westmead, and 1 in Hornsby.
So they're all men, did you say?
They're all males, that's right.
And 61-year-olds?
61, 76, 80 and 91.
Which ones were from the north? Which ones from Westmead and which ones from the north coast?
So the 91-year-old was from Port Macquarie, an 80-year-old from Westmead, a 76-year-old from Westmead, and a 61-year-old from Hornsby. So our condolences, Hornsby Hospital. Sorry. Yeah, that's right. So our condolences go to the families. And it reinforces the messages about this is a highly transmissible infection, that everyone is vulnerable at the moment, and so even younger people who may get more mild disease often have an important role in transmitting the infection to their loved ones, particularly the elderly. So heeding those measures about no gatherings, about not clustering in groups, and staying away from those most vulnerable is really important.